Welcome to Women in Healthcare Leadership podcast series brought to you by Medscape Education. Our goal is to provide a platform where we can educate, advocate, and inspire women leaders to lift as they rise. With every episode, you'll hear from her as we showcase the perspectives, insights, and experiences of women who are leading the way in advancing women's health and empowering the next generation of women in healthcare.
Welcome to today's episode of Medscape's Hear From Her, Women in Healthcare Leadership podcast series. I'm Elaine Bell, Director of Clinical Strategy at Medscape. I'm excited today to be talking about female leadership in the field of dermatology. Joining me today are two brilliant women leaders in this field. First, Dr. Melinda Gooderham, who is the Medical Director of the Skin Centre for Dermatology in Peterborough, Canada. She is also an investigator with Probity Medical Research, assistant professor at Queen's University, and a consultant physician at Peterborough Regional Health Centre. Melinda has been an investigator on over 220 clinical trials focusing on inflammatory skin diseases such as psoriasis, atopic dermatitis, HS, alopecia, and vitiligo. Welcome, Melinda.
Welcome. Thanks for having me.
Also joining me today is Mercedes Diz, the Chief Marketing Officer and Executive Board Member at Almirall. At Almirall, Mercedes leads portfolio strategy and commercial innovation for global brands, new products, and digital and cultural transformation. Prior to Almirall, she worked in a number of different pharmaceutical companies from J&J to Pfizer, and is also a keen member of the Healthcare Business Women's Association. Welcome, Mercedes.
Well, thank you.
So today we're going to discuss how we can close the gap and empower women to excel in leadership positions in dermatology. So let's get started. I wanted to begin by asking each of you in turn about your personal journey as female leaders in dermatology. Melinda, how has your background and experience enabled you to become a leader in dermatology?
Thanks for the question. It always starts, I think, in childhood. It starts at home. I grew up in a home with a mother that worked full time. You know, my father was the one who did the grocery shopping and made the meals. So I never really saw any difference between the role of men and women at home or in the workplace. But for my journey, it started with thinking that, I could just do whatever I wanted to do as long as I worked hard to get there. I think probably the major influences, though, over time, significant things were doing my master's degree before medical school. So that was the 2 years, probably the steepest learning curve in my journey of not just scientific learning, but also just learning about life, learning about people, how the world worked outside of my little bubble. And I think that made a huge difference. Then there was the role models all the way through education. There were a lot of strong female women leaders in my life, whether it was medical school, residency, or after residency. So that really helped, foster my own leadership skills. After graduating, I think starting my practice very broad, I really did everything. I did general dermatology. I did a lot of women's health. I worked in a vulvar dermatology clinic and the STD clinic, or sexually transmitted disease clinic. I did telemedicine 20 years ago before it was even a thing. It was part of a pilot project. It certainly wasn't people on their phones at that time, or studio was set up. Like it was quite a big deal. And trying all of those things and starting out broad. And then when I started doing clinical trials, that's when things really clicked for me. And I realized this was what I found most fascinating. It brought in what I'd learned in my master's degree. So I think that finding what you love, that really also helps rise to be a leader in that field as well. And then I think one other thing is really being a business owner. So I haven't been doing this like as, an employee of a university or of a hospital. I actually own my own private clinic. I have my own staff. So I'm a business owner and leader in that sense. And then also in the medical field as well.
Fantastic. Thank you, Melinda. So Mercedes, perhaps I can turn to you and ask about your own career journey and what particular experiences have led you to your current leadership role.
It's very funny listening to Melinda that our personal journeys influence a lot our professional ones, no? And I'm coming also from a different angle, no? My mother, we never worked, yeah? And I think she was so frustrated because she was a very smart woman that to my sister and I, she was always saying, you don't need to learn anything about how to clean the house or do anything. You need to go to the university. So for me, the objective always was like, you need to go to the university, you need to be autonomous. And I was a good student. And I liked science always since I was a child, like science as a way of innovating, doing things different, and helping others and changing the society. I ended studying biochemistry and molecular biology in Madrid. And during my career at the university, one of my friends got systemic lupus. Yeah. And it was such a shocking personal experience for me, seeing her, debilitating, having so many symptoms. She was a brilliant mind, probably the most clever person in the class. And I thought, well, maybe the lab not enough for me. I want to do something. So when I finished the university, while working a bit in the lab, I started to explore other things. And I learned about the pharmaceutical industry. And so many opportunities opened to me. I started as a sales rep in Allergan, actually, with Botox. And then I moved to DuPont Pharma. There was a joint venture between DuPont and Merck, doing marketing to Pfizer. And 20 years ago, I landed in this mid-sized pharma company, and I had the opportunity to have my first international role at Almirall. And I have been part of this project for 20 years, and that have gone like super quick for me. And so many opportunities. I have done global marketing. I have worked in business development. I have run a business unit in Spain. I have been part of the corporate strategy group that decided to enter into medical dermatology. And I went up to the executive board of the company. And as the first woman that went there in this company, in a society and an environment that is still difficult in some ways for women. So that's kind of how I arrived here. It's about, curiosity, learning, not being conventional. I have never been conventional. Yeah. And finding your way to reach your ambition and helping others.
I hear you're both saying pushing back the boundaries for women. That's great. Thank you. So, Melinda, I wanted to ask you then next about what you feel are the current gaps in dermatology care for women in particular, and how we can perhaps address those gaps for women.
Well, I think there are a few different gaps, starting with my area, clinical trials. So what I think probably spend most of my time thinking about, there are some gender gaps in clinical trial enrollment. As you mentioned, I've done quite a number of clinical trials, and recruiting for clinical trials and enrolling in clinical trials is a challenge to begin with. So when you see this imbalance, and I'll use psoriasis, plaque psoriasis as an example, because probably what we have most information on is the enrollment in psoriasis clinical trials is for the phase 3 pivotal trials for systemic agents is usually 2/3 or more men and 1/3 women. And why is that for a disease that's 50-50 in the population? I think there's a lot of different reasons why that might be, whether it's medical exclusionary criteria, such as for women of childbearing potential, the requirements for birth control in patients who may not be sexually active or may not be in a heterosexual relationship and not wanting to be on birth control because they're not at risk of pregnancy. So those patients being excluded sort of reduces the pool of women that can be in the clinical trials. So I think some of the exclusionary criteria and inclusion criteria for some of these trials might make it more difficult for women. There's also the societal aspects of women who may have their work as well as childcare on their list, and heading to a medical office every few weeks for to participate in a clinical trial might just not fit into their schedule. So I think there's a number of different reasons why women are underrepresented in some of these trials. There are other disease states, for example, psoriatic arthritis, where it's a little closer to 50-50. So I think we can dive in a bit more and look at what those reasons are. Those are some of the things that I've seen in my own experience in enrolling, why some women may not choose to enroll compared to some of the men. I think also how the diseases are affecting women compared to men. And again, with psoriasis being what we've kind of looked into most, we found, for example, from the SOLAR registry, which is a registrational study looking at, so SOLAR 1.0, the first one, 12,000 patients over 8 years. And what we found were that women were more likely to have anxiety and depression than the men. They were more likely to feel stigmatization. They were less likely to receive systemic therapy and more likely to receive topical therapy. Again, getting to that being worried about in childbearing years, they're just not being offered the same systemic therapy. They also were found to have less likely to have private insurance, more likely to have either public insurance or to be uninsured in the real world. So access to treatments can also be different, more likely to be divorced. So perhaps if their partner was the one with the insurance, they were, once they got divorced, they no longer had access to that medication plan. So a lot of different aspects when you just look at just one disease of plaque psoriasis, so many differences between men and women. Also, younger women, like age 30 to 44, were more likely to have metabolic syndrome in this if you had psoriasis than in women who didn't have psoriasis. So a lot of systemic issues, not just their skin plaque psoriasis, that we have to consider that causes these gaps in care.
Mercedes, what about your perspective about the barriers for achieving equal representation of women in clinical trials? What's the role of the pharmaceutical industry and what can they do to help in that regard?
So I think, fortunately, over the last years, there has been, a visibilization of this issue, not just with women, but with other, inequalities in the health systems. And regulators are taking action as well, no? And I think the pharma industry, we have very high standards, high ethical standards, and we need to comply with those. And we need to be, very mindful that when we design our clinical trials, and we do that at Almiral, the representation of women needs to be there, not just because regulators are starting to ask us, but because, we intentionally also do that. I think we can do more on listening to the patients. What are the struggles they have to participate in clinical trials? How can we make them more flexible, particularly for women and for certain groups of people that attending visits or monitoring may be more difficult. So we need to find, tools, technical enablers to participate. And we need to be mindful of this. So it's not just, I want to finish my trial. I want to finish my trial the right way with the right groups. Also, there are some groups of minorities, women, but women of color, for example, is even, more difficult to have them in trials. We are very proud that we have done the first study with a biologic on skin of color in atopic dermatitis. And this in dermatology is relevant. Melinda obviously knows much more than I do, but, different skin types behave differently. And sometimes the endpoints, and the scales need to be adjusted, and we need to understand the implications of this skin of color in the trials. So for me, it's ethical behavior, following the guidelines, transparenting the problem, publishing, understanding, doing maybe, some adjustments on the trials, and walking the talk, yeah? There is another aspect regarding not clinical trials, but real-world evidence that we can also foster from the pharmaceutical industry and ensure that once the drugs are on the market, we also collect data and we work with dermatologists to make this published and clear and understand what are the implications there.
Thank you, Mercedes. Melinda, you wanted to pitch in there.
Yeah, I just wanted to add one thing about sort of breaking down those barriers and as you point out, it may not just be for women, but women from other with skin of color, other disadvantaged groups or racialized groups. Is sometimes, there is like a transportation fee or a payment when you come to a study visit that's set for everyone, right? But everyone's coming from a different situation. They may be coming from further. Maybe they have to arrange childcare. So I think there should be more of a sliding scale in those study payments to the study participants. I think that's something simple that could be an easy thing to implement to account for some of the barriers that some patients may have in joining a clinical trial.
That's a great point. I think that's a nice challenging one to leave with Mercedes for some future action.
No, of course. And we are mindful of this. And I think we have the willingness, but sometimes we don't understand all the nuances. So it's this partnership with, investigators and with CROs that should allow us to do better. I also want to note that there's so many things that happen in all the ladders of the system that are, making these health inequalities happen. And this has a huge economic impact. I was reading a report from McKinsey on the World Economic Forum, and they are estimating $1 trillion from 2040 that we could revert into the system every year if we could minimize the health inequalities in women in the entire system, about productivity, being treated well, extending lives, but also improving how we live every year of life. No? And it's amazing when you read it.
It's quite a staggering figure. Let's switch topics slightly. I was wanting to ask you, Melinda, what do you think is the role of education, both for clinicians and patients, in terms of improving outcomes for women with dermatological conditions?
Obviously, education's always important on both sides. I think for improving healthcare of women, it's really incorporate all that I talked about earlier in psoriasis, all the differences in the mental health burden in women. And that is actually paired with slightly lower clinical scores in women. So the psoriasis burden might be a little less, but the psychologic burden and the psychosocial burden is higher in women, even with psoriatic arthritis. So, for example, if you look at tender joints, swollen joints can be same between men and women, but women have more tender joints. They also have higher PROs with pain and quality of life impact. So being aware of those differences can really only be shared through education. And instead of making specific education programs about women, it should just be part of our regular education. Same with the diversity of skin tones. We shouldn't have special sessions, just let's talk about skin color. It should just be normal that we talk about it in all of our regular education. And I hope that someday that's how we do it. This is the overall data. This is the gender differences. This is the racial differences. This is what we need to learn more about. This is what we need to appreciate, how these medications work or how the disease affects differently in these different groups. So that's the education for the clinicians. Of course, with patients, it's making them aware of things. How many times do patients with their skin psoriasis, their plaque psoriasis, when we give them a PEST questionnaire, which is screening for psoriatic arthritis. I even had a patient yesterday who said, why do you want to know about my joints? That has nothing to do with my skin. So patients still today, even though we think, there must be enough information out there that they should know, they do not know that these other comorbidities can be related to their skin disease. So educating patients that they need to talk about other issues with their dermatologist that might be related. Hopefully we're asking the right questions, but if patients are empowered to know what they need to share. So education for the clinician, education for the patient, I think in the end can improve healthcare across the board.
Well, that's a very big question.
Let's turn back now to your careers as women leaders. Mercedes, I wanted to ask about, in your experiences, what key challenges or barriers you have experienced, and what particular solutions you think, reflecting on those barriers, that we can use going forward to help elevate women as women leaders in dermatology.
I have faced many challenges in my career. For me, it was more about fighting myths and fighting hidden biases, microaggressions that you have, no? 2 weeks ago, I was invited to a panel of HBA that was called, and I love the title, Women and Ambition. Yeah. And how these two words were like forbidden together. Yeah. But you need to be able to say it and to verbalize your ambition and call out in a nice way, because sometimes it's not that people don't want to help or realize. It's that they don't simply realize, no? How many biases we have. Even women, we don't realize. I'm going to tell an anecdote. When I was nominated to the executive committee of Almiral, I reached out to Alexa Kimball, that is in our board, that is a dermatologist in Harvard Medical School. And I asked, Alexa, give me a couple of tips, what I should do or not do. And she says to me, Mercedes, you need to learn to hold your chair. Hold to your chair. And I thought, well, she means that I don't need to let anyone to take my chair. No, she said, no. When you see a coffee cup on the table, hold your chair, because you will run and take the cups. Yeah, men don't do that. Yeah, hold to your chair, don't move. Yeah. So it's these small things that we don't even realize, but we do all the time, and it's normalized, no? And then, of course, you need to get ready. You need to prepare yourself, not over-prepare yourself, because we also tend to be like, we need to be like over-skilled, over-prepared. No, prepare yourself, yeah, technically, but also be ready to receive criticism. Surround yourself with good people as well, at home and at the office. And then verbalize the things. It's very powerful when they are not expecting sometimes that you will say, I want an increase of salary and I want that position. And it's super powerful, and you are surprised sometimes how much people help you when you say the things that you want.
Yeah. Be ambitious and go after it. That's good to hear. Melinda, what about from your perspective as a practicing dermatologist? What have the key challenges been that you've faced, and how have you overcome them?
I really like what Mercedes said about fighting the hidden biases. I think that's probably been the number one thing. And as I mentioned, through my journey, there have been a lot of strong women along the way. And I think in Canada, things are fairly balanced in that sense, as far as, who's speaking on the podium at conferences. It's fairly diverse as far as gender and race. But I find some global conferences aren't quite the same. But for an example, 2 or 3 years ago at the EADV, in the very recent past, I just thought I would look just at the industry symposia, do a bit of an assessment for a specialty that's at least 50% women. You would expect the faculty on the stage to represent the audience. And I was seeing that wasn't a case. Overall speakers in the industry symposia was only 1/3 women. There were only 2 symposia that were all women. One was a purely aesthetic session. And I think there were 8 symposia that were all men. And then when you bring it up, there's always there's 2 responses. One is we asked some women who said no. So we went with the men. My response is always, there's always more women to ask if you want to have a woman on stage. And the other is that, well, there's women who aren't at that level yet to be up on the podium and be an expert in that field. And then my answer to that is, well, how are they ever going to get there if they never get the invitation? So that's been one of my more personal fights that I've been dealing with. So that is one barrier, is getting women in medical education. Others on a more personal level, because things are so busy and because there's so many new advanced therapies in inflammatory diseases, as a general dermatologist, I find it hard to keep up in the other areas. And finally, is the work-life balance and burnout, is managing that. And I really wish I remember who said this, but a very smart woman said that, there's times when she's an excellent doctor, but a bad mom, and times when she's an excellent mom and a bad doctor. And it's really hard to be excellent at both at the same time because they both require time and energy. So it's trying to find that balance. We should really learn more about how to balance. No one ever teaches you how to do that. So one thing I think we can help the next generation of women leaders is really how to manage that work-life balance.
Yeah, and life can always throw you a curveball. It's not always easy to plan, to negotiate and manage all those sort of work-life balance issues. Sure, it's not. We're coming to the end of our time together, but I really wanted to ask you both about the key skills you think are important for women leaders and what your own personal top tips are for women who aspire to be women leaders in dermatology. Mercedes, perhaps we could start with you first.
I think to be a leader in dermatology, in the dermatology industry, first of all, you need to work hard in terms of having the right knowledge and expertise. So be ready and prepared. I think you need to be someone creative. Dermatology is a quick field and you need to be able to innovate and find new things. And for women, I think we can bring values that traditionally have not been so relevant, like, being able to embrace more diversity, work more with other disciplines, whether in the industry or across, medical disciplines. So I think we should bring those values of collaboration. Yeah. Don't get obsessed. Do as good as you can until you know better and then do better. And I hate when men tells us women don't collaborate to each other. That's radically not true. So, and we need to show the world that collaboration is the way to go.
Mm. Melinda, what about your experiences in terms of, or what about the advice you would give, your top tips? But I also wanted to touch on mentorship, which we haven't really discussed a lot. So any thoughts on how mentors have influenced your leadership development?
Yeah, throughout my journey, as I mentioned, a lot of strong women throughout along the way. So just to name a few, Lynn Gunther, when I was a medical student, was a general dermatologist, but a clinical trialist. So I could see how she ran her practice and how she did teaching and things like that. So I really liked how she did things. So to be able to connect with women along the way who could be a mentor, or find it like a sponsor along the way. It doesn't have to be a woman, but really finding what you love, spending time with someone who does that. And as Mercedes says, be the best at it. Make sure, that's what I say to my 3 daughters. That's what I say to them. Whatever you want to do is whatever you want to do. Just make sure you do the best you can at it in whatever field you choose to go in. As far as specific tools, or I think you mentioned earlier about what you should work on, I always think that presentation skills for this field are really important, whether it is medical education, whether it is reaching out to patients on social media, being able to transmit messages through education is so key in this field that I think you can never be too educated on presentation skills. And you really will get a return on investment if you really invest in how you can present yourself and how you can relay a message.
That's great. Some very useful advice there, I think, for our listeners. So we're rapidly running out of time. Any final thoughts or comments, and then we can wrap up?
It's very funny that Melinda talks about presentation skills. That's one thing that in my department, everybody needs to do every year. And I agree with you. You never stop learning. You need to have impact and you need to continue developing your communication skills, particularly for those of us that, for example, English is not our mother language. No, a final thought is thank you very much for organizing this. I think a big portion of this is just, giving role models to the people to follow, ideas, and keep on talking and helping each other.
Thank you. I really just want to thank both of you very much for taking the time to join me today. The discussion's been great, and I really appreciate that you've both been able to come along and join in and elevate these conversations for women in dermatology. And I'd like to wrap up by saying thank you to our audience. Thank you for listening. Please watch out for the next episode of the Women in Healthcare Leadership podcast series. Thank you.
Thanks for joining us. Tune in next week as we continue our journey to amplify the voices of women leaders in pharma and medicine. Hear From Her is brought to you by Medscape Education. Please subscribe to Hear From Her on your preferred podcast channel and follow us on LinkedIn. Until next week, remember to lift as you rise.